Hey everyone, Robert here. It's May 14th, 2020, and I want to discuss the latest bill to be set in Congress, the H.R.6666 COVID-19 Testing, Reaching, and Contacting Everyone Trace Act. Now, we're going to go through this, and yes, I am going to hit on the number here after a while. But we're going to go ahead and unpack this bill, and I'm going to go ahead and give you my concerns as to why this bill may not be a good idea and what it could empower others to do. And as always, I will have links to everything that I'm talking about here in the description of this video on YouTube. Now you can go to congress.gov and look this up. Right now we're on the summary. You can take a look at the text area of this. This is a great web resource to be able to look up bills, but getting into unpacking, and I'm going to be referring to notes. This bill authorizes the Centers for Disease Control and Prevention, the CDC, to award grants for testing, contact tracing, monitoring, and other activities to address COVID-19. So basically, they are going to be setting up funds to contact tracer, to be able to employ contact tracers throughout the country, as well as other areas that are needed to be able to address the pandemic in our country. The bill was introduced on May 1st, 2020 by Representative Bobby L. Rush, a Democrat, and has yet to pass a vote in the House. Now, this is where it stands right now. It has been introduced, but nothing has been voted on in the House, and it was introduced back at the beginning of May. In general, the Secretary of Health and Human Resources, acting through the Director of the Centers for Disease Control and Prevention, may award grants to eligible entities to conduct diagnostic testing for COVID-19 contact tracers, to trace and monitor the contacts of infected individuals, and to support the quarantine of such contacts through, as necessary, testing individuals and providing individuals with services related to testing and quarantine at their residence. So basically, money's going in to hire people to get data on people who may have the disease. Now, I talked about this in an earlier video, getting into contact tracers and what they are. Contact tracing is not bad. It has been around for decades. It's been around since polio came into existence. It is not a bad thing. But what I have seen a lot of the CDC and people within the CDC kind of chomping at the bit to do is to gather more data, utilizing fear. But moving on with the unpacking. Applicants that agree in hiring individuals to carry out activities funded under this section, and the sections they're referring to in this are under this bill, and again, links will be in the description. Under this section, to hire residents of the area or community where the activities will primarily occur with higher priority among applicants described in this paragraph, the paragraph that you'll be able to read, given based on the percentage of individuals to be hired from each area or community. So basically what they're going to be doing is hiring within the community. So I live in a rural town in Missouri, so they would hire people within my community to be contact tracers so that there can be a friendly face, because I think they've probably found out that census takers were having a hard time because they were strangers in maybe a closed community. So they're going to be hiring within the community. Moving on. A disproportionate share hospital as defined under the applicable state plan under Title, let's see, got to read my Roman numerals here. Title 14 of the Social Security Act. Share hospitals include academic centers, high school and elementary schools, faith-based organizations, which include churches, and any type of entity that is determined by the Secretary to be an eligible entity for purposes of this section. Now, this is the broad stroke area. In a nutshell, what they're doing is that The CDC, along with the public health department in your area, will be able to set up makeshift hospitals or places where people can be quarantined. This could be a high school, this could be a college, this could be an organization center, it could be a church, it can be any of those things and any other structure deemed necessary by the Secretary of Health. And that has a lot of broad strokes with that, but I move on. This bill would continue through this emergency period. The emergency period is determined by the Secretary of Health and Human Services. So basically, it comes down to one individual or a group or a part of the government that determines how long this bill, if it becomes a law, how long this law would continue to go on. How long would they send out funds to be able to employ contact tracers, to be able to employ wraparound services for people who are under quarantine, people who need these other things? How long would this go on? Well, it sounds like it could go on indefinitely. I mean, there's no clear-cut way. And really, not speaking in favor of the people, we really don't know how long this is going on. They'll probably make COVID-19 will probably make 2, maybe 3 trips around the globe, something to that effect. So this can go on for quite some time. Now, getting into my concerns, and I'm first going to address the bill number, H.R.6666. Now, there is a reason that the bills are numbered in the way that they are numbered. It's not like they, flip a coin and decide, hey, let's go ahead and number it this way. And I've got this in the description as well. Bill is a legislative proposal before Congress. Bills from each house are assigned a number in the order in which they are introduced. So this is an order, but it's a very coincidental order. And I got to tell you, with the way that everything is being politicized now, with everything that is happening in this country, I mean, you are seeing clear divisions as to people who will wear masks, people who will not, people who would take the vaccine, people who are not. And it is a very down the middle of the aisle type of thing. And if you get a bunch of Christians like myself that kind of look at this, and the only reason why I decided to do a video on this is because of the number, well, I mean, I know it's one more than the mark of the beast, but by golly, 666 is in there, and this is very much a controlling measure. This is very much a controlling bill, and I honestly think that they should have ran it past a marketing department. Maybe they should have done like 7777 or something like that, but I understand that they don't really have total control of it. But in any case, that's how the bills are numbered. Not really a good number, especially if you're wanting a bunch of Christians to comply with the governing authorities at this time. Now, these are my overall concerns. The bill creates a financial incentive for people hurt economically to gain employment by spying on neighbors. Now, contact tracers is going to be a growing industry. There are colleges and universities that will be very soon, if they haven't already, set up a part in their education where they will train individuals. You are going to be trained through the CDC and be able to collect data for individuals in your community that may have it. And again, a link is in the description describing more of the contact tracing and the problems that I have with it. But we're nearing 25% unemployment. Right now, I think at the making of this video, it's roughly about 18%. And people who are hurting financially are going to be grasping at any type of job that they need to be able to pay the bills. And if you are willing to, basically you are spying on your neighbor, being a contact tracer, and the data gathering that you are needing to get, you are basically going to be in charge of a group of people, and they are giving you the carrot and the stick to be able to do this type of thing, where normally you wouldn't do it if people weren't in such a financial hurt right now. The emergency period is the big one for me too. Is determined by one person or group, and as long as we are in an emergency, the bill or law will remain in effect. And see, that's the thing. It really, there is no end in sight with this bill, because what are our numbers supposed to look like for stopping all the stuff that we're dealing with? I've heard individuals talk about that through the CDC that have talked about that the numbers have to be at a low percentage. Well, you are going to have upsurges in coronavirus infections. You are going to have instances where deaths could be attributed to coronavirus. So that's going to play a part into whether the emergency continues. I mean, that is a big thing. I mean, the Patriot Act. The Patriot Act came into existence in 2001, shortly after 9/11, and we are still living in the Patriot Act, and that's bothersome to me. The gathering of information is done by trusted individuals. That is another thing. Normally, I would not trust giving my information, how much I make, where I go, how many people are in my household. I don't trust that to strangers. But if a friend within the community were to come up to me, I am going to be hard-pressed to say no. I'm going to be very hard-pressed to deny the person the information, especially if they put on me that, hey man, it's my job, I got to do this, otherwise I don't get to eat. I mean, all of these things could come into play. I mean, really, it's disconcerting, and the amount of information that is gathered from the stack of normal demographic information, but also in wraparound services that the CDC and the Department of Health within the community provides for each household. You are getting into buying habits, you're getting into work habits, you're getting into a whole bunch of data. And the CDC, at least the trainers in San Francisco on the contact tracing video, they would love to be able to hook into the Department of Motor Vehicles and other databases to gather more contact information, as well as being able to to have the information to be able to research and create a social profile or a financial profile to see how money can incentivize people for cooperation. And that is very disconcerting. This is a big one right here. People can be removed and the family unit will be used against citizens. Now, I know that sounds really tin hat foil wearing, and it sounds conspiracy. There is a county that a doctor came and gave a press briefing saying that if a person was infected within the household, that person would have to be removed and quarantined from the household.
We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available.
Now, that is a thing where the idea of family can be used against itself, because if the family's household is small, they only have like one bathroom or things like that, and someone in the family is infected, that individual can be taken out and put into a quarantine area where their needs will be provided for. And again, on the contact tracing, the Department of Health will be able to issue orders to the governing authorities to be able to remove that person forcibly should they not want to be tested, should they not want to answer questions, should they not want to be removed. So the family unit can be used against itself, and compliance, I mean, it's almost forced compliance. The more information gathered and social services people get used to, the more willing control will occur. So this is the thing. With regard to money that is being thrown at different communities, they're going to be able to employ people that are out of work. People are going to be given a purpose. People are going to be given in this training that you are doing this for the common good, that with your help, our country can open back up. With your help, our family can be safe. And all of these things that I know these people believe in, but these trainers are going to be throwing at you. The amount of data that is going to be able to be collected from contact tracers within the community is going to be staggering. This bill is going to be a giant carrot and stick to the community to be able to employ people doing something and spying on their neighbors, gathering information for a government agency that they wouldn't normally do. And that's the whole thing with this bill. And I think that it is a little bit beyond coincidence that this bill has at least 3 of the numbers of the mark of the beast.